I want to thank Dr. Lee for doing the first part of my lecture on diabetic peripheral neuropathy. Again, the same slides. And we'll go on to fibromyalgia and rheumatoid arthritis. So how many of you have patients with fibromyalgia? In all practices, we have a very common problem. Fibromyalgia is more common in women, and for a long time, doctors did not have a good handle on the cause of what fibromyalgia is all about. Now, before I started working in multi-care as an inpatient rehab physician, I did 12 years of practice in pain. And so I saw many patients with fibromyalgia, and I had the opportunity to introduce them to a vegan, plant-based, healthy diet. And it's so gratifying when you take people who come to you with a whole bag of medications that are giving them all sorts of problems, constipation. They're so addicted to them that they can't sleep without them, and then they have to get on benzodiazepines as well as opioids, and they're on gabapentin, they're on Lyrica, and SSRIs. Venlafaxine, duloxetine, and to be able to reduce their medication substantially, get them off opioids based on exercise, getting plenty of sleep, and a plant-based diet. It's very gratifying to be able to do that. And that's what I did for 12 years in private practice. And then I joined multi-care as it became evident that insurance companies were not going to really be able to support my type of practice in pain. So I went to multi-care, and I've been at multi-care doing acute inpatient rehabilitation, and I see many people with diabetic neuropathy. And I still tell people that the best treatment is lifestyle management. And in fibromyalgia, recent evidence shows that people who have fibromyalgia, it's actually a problem with oxidative stress. And the neat thing about a plant-based diet is that it can reduce oxidative stress in the body. We're talking about antioxidants, vitamin A, vitamin C, vitamin E, selenium. And the important thing to notice is that when you prescribe supplements, oftentimes you overshoot. If you get too much vitamin A, you get hypervitaminosis A. If a person gets too much vitamin E, they start producing pro-oxidation products in their bodies. But if you instead prescribe a healthy vegetarian diet, where instead of taking supplements and the end products of what your body can turn a beta carotene into vitamin A, retinoic acid, or you take gamma tocopherol, and then what the body needs, the body will turn into alpha tocopherol, the active vitamin E. When you prescribe a healthy diet, you don't have to worry about giving them too much, because what the body needs, it will convert to the active form. And so it makes sense that if you have a high oxidative stress condition, such as fibromyalgia, and you put them on a plant-based diet, And another thing about plant-based diets is that you don't have the hormones of the animal that was suffering before it got slaughtered, and so you don't have that all the hormones that are actually in the meat and can be measured, and so you can sleep peacefully. It's one of the side effects. The universe rewards you for being a plant-based eater. You get to sleep, and so I found in my practice that prescribing a vegetarian diet for the people who do follow that, they can get off their medications. Some have gotten completely off. Some use non-opioid medications, SSRIs, but a lot less than they did. And this is also confirmed by studies. The effect of vegetarian diet on fibromyalgia patients. There's a decrease in serum peroxides, which shows that there is an improved antioxidant status. Vegetable-based diet, plant-based diets also decrease fibrinogen concentration. And Dr. Christian demonstrated that there are decreases in lipoprotein-related risk factors as well. And so you get to be healthy, heart healthy, and that circulation improvement can also help decrease pain as well, because part of the thing that causes pain is the lack of circulation to bring in nutrients and to take out oxidative products and wastes. Another 7-month study with a vegetarian diet showed that there has been a 50% reduction in shoulder pain, range of motion, flexibility, how long a person can sit, and how long a person can walk. And that's also on the Vegetarians of Washington website. And then a shorter study shows that a plant-based diet will reduce joint stiffness, improve quality of sleep, improve quality of life, and reduce body mass index as well. Now, let's look at autoimmune disease. So if you look at, this is another Seventh-day Adventist study. The Seventh-day Adventists are a very interesting population. Their religion prohibits smoking and drinking. But there's also a wide range of dietary practice. They are encouraged to be vegetarians, but some are semi-vegetarians, some are non-vegetarians, because that's not as strictly enforced. But in order to become Seventh-day Adventist, you have to swear off drinking and smoking. And so you will see a wide range of dietary practices, and it's already pre-controlled for smoking and drinking. And so what differences you see can be widely, greatly attributed to diet alone. So it's a very interesting group of people to study. And when they look at Seventh-day Adventists, in women, those who are non-vegetarians, they have a 57% increased risk for rheumatoid arthritis over the vegetarians. And then those who are semi-vegetarians that may occasionally eat poultry or fish, they only have a 14% increased risk over vegetarians. So the vegetarians have the lowest risk of rheumatoid arthritis. This is also true for men as well. Now, women tend to have more rheumatoid arthritis than men, and so you see more of an effect in women, non-vegetarians. But essentially, we see the same numbers in terms of risk for rheumatoid arthritis. Now, rheumatoid arthritis is an inflammatory condition, as you know. And it makes sense that plants, which are anti-inflammatory, can reduce this by 50% or greater. Now, studies that show treatment of rheumatoid arthritis with a vegetarian diet, there are significant improvements. Again, similar to fibromyalgia, where there's about a 50% reduction in joint swelling, the pain score, improvement of grip, decreased severity of morning stiffness, decreased duration of morning stiffness, improved function, and the reduced number of swollen and tender joints, and improvement in the Ritchie's articular index. And again, all these references are on our website at Vegetarians of Washington. And finally, the last study, again, reproduced these findings where the white blood cell count, as you know, the white blood cell is what mediates the cellular component of autoimmunogenicity in rheumatoid arthritis, and the leukocyte count goes to normal. There's improvement in IgM, which is what we look at in rheumatoid factor. Complement components are also reduced, as well as sedimentation rate. C-reactive protein goes to normal. And this organism, Proteus mirabilis, which is often found in people with rheumatoid arthritis, also goes down. So that's my talk on fibromyalgia, rheumatoid arthritis, and pain. And again, thank you for your attention.